Hi everyone, it's Nick from Revup Dental, and today we're going to talk about how you can double your patient flow in 2024. So most dental offices think that if you want to drive more patients, you have to do more marketing. And I mean, that's kind of the message most marketing companies push onto dentists. You know, you'll hear things like, you have to do some SEO, you have to do social media, you know, you've got to do flyers or you know, whatever, any number of million of options you have out there for marketing. And most practices, if let's say they're doing 15 new patients a month, and maybe ideally they want to get to 30, 40, 50, they're going to think, you know, maybe we need to do some more marketing, maybe we need a better website, maybe we need to do some SEO. And these are all, you know, to some extent valid tactics. I mean, yes, they can definitely drive more new patients, but most offices out there, I think that they could probably double their patient flow without spending a single extra dollar on marketing. In fact, many of them could actually reduce how much they're spending on marketing. The biggest reason most offices are not driving more patients has, you know, usually very little to do with your website or your marketing. In fact, the biggest bottleneck to, you know, why you're not getting twice as many patients as, you know, you could be is usually the staff. And specifically, it's the staff's lack of sales skills. It's not that your staff are bad people and they're trying to do a bad job. It's most dental receptionists out there don't really know a heck of a lot about sales. They don't really understand any of the sales strategies that would be very effective in, you know, leaving patients with a better first impression, making them feel welcome, making them feel appreciated, leaving that patient with this idea that, you know, this sounds like a really nice practice, I really want to go here. One of the first things we ask dentists that, you know, reach out to us to help them drive more patients is, you know, hey, if you were to get, you know, let's say 10 new patients called your office this week, how good do you think the staff are at booking those patients? Like, how many of those 10 leads do you think would convert into an appointment? And all the time we hear dentists say something like, oh, my staff are amazing. You know, if 10 people called, I'm pretty sure that they would book, you know, 8, 9, 10 of them in for an appointment. And then we ask them, well, that's, you know, that sounds really great. How are you tracking that? And they tell us they're not tracking it at all. In fact, they don't actually measure, you know, how many calls they got. They don't measure how many they actually converted, but yet they seem like really confident that, you know, their staff is amazing. And we asked them, you know, what makes you so confident? I mean, if you don't have any data, what makes you think that the staff are doing such a great job? And a lot of them will be kind of caught off guard by that question and, you know, kind of stop for a second.
Well, I'll tell you why. Because...
But many of them, you know, they really double down and they say like, no, I know my staff, they've been with me for years, they're phenomenal. I think they're doing an excellent job. I'm very confident that, you know, if you guys were to get us, you know, 10 new patient leads, I think almost all of them would basically, you know, would turn into a patient at our office. Well, at Revup Dental, we spent a lot of time and money building a software that basically analyzes that. So we look at every single call that comes into a dental office. We look at every appointment request that a client might receive that month, and we make sense of what happened. You know, we can tell what type of call was it? Was it a new patient? Was it an existing patient? What were they looking for? What was their name? Who did they talk to? How did the interaction go? Was the staff nice? Were they friendly? Were they helpful? You know, what is the end result? Did they book the appointment? And if they didn't, you know, what went wrong? What could they have done differently to, you know, ensure a better result next time? And here's the crazy thing we found. From the tens of thousands of new patient calls that we analyze each month from hundreds of offices across, you know, North America, the average dental practice that we start working with, you know, on average, if they get 10 new patient calls, they might book maybe 3 or 4 of them into an appointment. In fact, the average booking rate for most offices that we start working with is somewhere around maybe, you know, 30 to 35%. So in other words, if 3 new patients call the office, most offices are probably only going to book 1 of them in for an appointment. And this really like shocks a lot of dentists. And when you show them this data and you go through, you know, what we discover, inevitably a lot of receptionists and a lot of office managers as well, you know, they can get very defensive and they'll come up with all kinds of excuses and say, oh, well, you know, those patients, they just weren't good patients, you know, like that's why they didn't book. And we asked them, like, well, why aren't they good patients? I mean, they're calling for dentistry. People don't call a dentist for fun. What makes you say that they weren't a good patient? And they'll say things like, oh, well, they were just price shopping, or, they just didn't really seem very serious. We told them that they have to come in for a consultation and, they didn't want to come in for one. Or they'll say, oh, they're an insurance patient, they're on ODSP or Medicaid, or they had, Delta Dental, and we don't accept that. They were very insurance driven. That's why they didn't book. Now, here's the thing. It's easy to blame the patient and say, well, they just weren't serious, or, oh, they were just a price shopper. It's easy to kind of place the blame on the patient and, kind of divert any sort of accountability on your end. But the reality is most patients, they're calling for a reason. They're not calling your practice because, they just, they have nothing better to do. They just want to make a friend. They want to buy dentistry. What they're not sure about is whether they should buy it from you or the 10, 20, 30 other offices in the area that are also happy to accept new patients. It's a really hard pill to swallow for a lot of, offices, a lot of dental receptionists, a lot of office managers that, when that patient decided not to book with you, it, most times has really often nothing to do with price, because most offices, if you were to kind of like look around, their prices are all very similar. It's not like one office has figured out a way to do implants for half the price, or they found a way to do Invisalign for 40% less than everyone else does. Most offices kind of follow the same fee guide. And a lot of offices we work with, we ask them, how do you know you're not the cheapest price? Like, what do all these competitors around you charge? And I've yet to find one that was able to tell me, exactly what their competition was doing. They all assume that the patient didn't book because, they found a cheaper price elsewhere. The reality is that, oftentimes the reason the patient doesn't book is an emotional reason. After talking to your team, they just felt maybe they weren't super friendly, maybe they weren't very helpful. They just didn't get a good sort of first impression. And when they're calling around, they're not necessarily calling around to see if somebody does that same procedure for cheaper. They're calling around to see who they like, who they trust, who sounds like, maybe a better fit. And inevitably, most of these people end up calling another practice that they just emotionally connect with better. They just feel like they're nicer, they're more helpful, they're more genuine, and ultimately they make an emotional decision and they decide to book with another office. When we show this data to the dentists that we work with and we start playing recordings, actually helping them see, here's the kind of interactions that your staff is having with patients, here's what they're saying, like let's listen to the recordings and let's put ourselves in the shoes of this patient. Would you have booked here if, someone had talked to you this way? And we often get, emails back kind of like this one. This dentist wrote, "I'm absolutely appalled by this. I can't believe this is my staff." Another dentist wrote, "Oh my God, this is not the way I want my business handled. Thank you for bringing this to my attention. I will address this ASAP." I can tell you that from working with hundreds of offices across North America and listening to, hundreds of thousands of new patient calls every year, there are indeed some practices that if you were to give them 10 leads, they would very consistently close 7, 8, even 9 of them into a booked appointment. Whereas the average practice would be lucky if even 3 or 4 of them turned into patients. When you analyze as many calls as we do, and you start to look at the practices that are very successful at booking patients, and you listen to how they handle patient calls, the kind of questions they ask, the types of things they say, the way that they handle objections that patients bring up, or just the overall interaction, you start to notice like a really huge difference between how they approach talking to new patients versus how the average dental practice does it. Now, the training that we provide to our clients when we're teaching their staff how to get better results and book more new patients on the phone, we essentially look at what these top practices in North America are doing. And we break down and we reverse engineer how they talk to patients and how they answer different questions. So we're not really teaching, hey, here's based on my experience what used to work in 30 years ago. I mean, we're teaching them what very successful offices are doing today to book 2 to 3 times as many patients as the average practice is doing. If you want to learn how your staff can better handle new patient calls, how to ultimately book more patients, fill up your schedule, get more butts in the chair, we've put together a really useful free guide that you can download where we cover one of the most important areas of how to handle the phone call better, which is asking really good discovery questions. In this guide, you're going to learn how some offices approach the conversation differently right from the start, how they take control of the conversation, how they ask good questions to engage with the patient, and ultimately how to create an amazing first impression with that patient, which leads more people to book an appointment with you instead of calling around to see what other practices offer. The guide is packed with a lot of great verbiage and examples of how your staff can handle different questions that come up from patients. We even break down exactly what you should be saying depending on what type of service that person is calling about. So whether they're calling about Invisalign or dental implants, the questions you would ask could be a little bit different, but it would still lead to a much more engaging conversation. And ultimately, the end result is that patient's gonna have a better experience talking to your staff. They're gonna like you more, they're gonna trust you more, it's gonna fill up your schedule with more patients, it's gonna get more butts in the chair, and you guys are gonna be better for it. So head on over to www.revupdental.com/discovery. You're gonna find the guide there. You can download it, print it off, hand it to your staff. Use that material that we teach there, and you're gonna see much better results this year. I hope you found this video useful. If you did, remember to give us a thumbs up. And maybe leave a comment down below if you downloaded the guide, if you use some of the verbiage we teach there. Did it have an impact on your conversion rate? Are you seeing more patients because of it? That feedback is incredibly useful to us. And if you want to see more videos like this one, if you want to get more guides, consider subscribing to our YouTube channel or visit us at revupdental.com. Thanks for watching, and I'll see you in the next video.